Hello, good evening, and many thanks for joining us here on Rwanda Television News. We hope you had yourselves a very fruitful day. Now, atop of our edition tonight, these are our headlines. Deputies in the Rwandan Parliament have requested the Ministry of Finance and Economic Planning to increase the budget invested in agriculture and to follow up on its usage. The Water and Sanitation Corporation, also known as WASAC, has been urged to speed up the expansion of water pipes in the areas that need them. We're glad to have your company tonight, coming to you straight from the heart of Africa, Kigali. My name is Martina Evera. Now, as we begin this edition of the news, let us inform you that on Tuesday at Urugwiro Village, President Paul Kagame received Pamela Coke-Hamilton, the Executive Director of the International Trade Center, and her delegation for a discussion on trade, investment, and Africa's position in changing face of global trade. The International Trade Center has put trade-led growth at the center of its work in developing countries. Now, deputies in the Rwandan Parliament have requested the Ministry of Finance and Economic Planning to increase the budget invested in agriculture and to follow up on its usage. This is after the Committee on National Budget and Patrimony analyzed the 2023-2024 draft budget and found that the budget allocated to the Ministry of Agriculture and Animal Resources has deducted by 14 billion Rwandan francs. We have more with Prince Manzi.
The Minister of Agriculture and Animal Resources points out that the lack of enough budget hinders the development and implementation of various agricultural projects. The agricultural sector works properly when the Ministry of Finance understands well the agriculture. People are not yet aware of agriculture and all related activities, rationalizing like how it is done for the rest. I think it is because of lack of enough budget. According to deputies in the Rwanda Parliament, the budget allocated to the ministry is still low and the provided is misused, and this hinders the agricultural sector. The few we have is misused, and the affected are the citizens. The law is there to support people. They should inform us on what to be changed. Why buying through intermediaries? The law should not be the issue. Why not informing the minister and we collaborate with the local company as the issue is irrigation? Is this that hard? In the draft budget, the Ministry of Agriculture and Animal Resources was allocated 154,822,180,639 Rwandan francs from 168,851,415,807 Rwandan francs, equivalent to 14,039,279,168 Rwandan francs deduction. Experts demonstrate that for the African continent to have food satisfaction, each country has to invest at least 10% of its budget in the agricultural sector, but most of the countries, including Rwanda, are still unable to achieve this. Prince Manzi, RwandaTV News.
Thank you, Prince Manzi, for that report. The Water and Sanitation Corporation, WASAC, has been urged to speed up the expansion of water pipes in the areas that need them the most. Gisle Mugwaneza with more.
Residents in some parts of Kigali city appreciate the fact that water shortage problem has been solved. However, there are other serious matters that should be put into consideration. In the past days, water pipes used to get damaged and get fixed in almost 2 days. But now, it can be done in just 1 day.
The issue of shortage water supply is general, since you may find that sometimes we spend almost a week without water, and this water shortage leads us to pump that from swamps, which is not necessary at all.
The members of parliament have repeatedly pointed out this problem to the Water and Sanitation Corporation.
Like in Bugesera district, they're still getting water from rivers and swamps, which seems to be a very big issue because we all know the consequences of drinking dirty water and diseases that develops from that dirty water. So my question is that you are aware on what will be done to address that issue, or have you ever discussed with the district on the measures they took to solve that issue, plus the loss of WASAC's wasted water supply, which is equivalent to 9.9 billion, according to your records. do you see any increase or decrease? Because since last year, there was that loss, and it seems that it's not solved yet.
The annual report of the Office of the Auditor General for the year ended in June 30th, 2022, shows that from January 2021, WASAC had cumulatively incurred a loss of 4.5 billion Rwandan francs in form of fixed cost for unsupplied, which showed that WASAC buys water from Kanzenze water plant at 909 francs per meter cube and sells it at between 323 and 895 francs, which was pointed out as a huge loss. Alex Kamuhire, the Auditor General, points out that the institution has faced a very huge loss from damaged water before reaching to the customers.
In WASAC, they're still having this big loss from wasted water, which is about 45% of processed water, and that loss is equivalently to 9.9 billion, counting on the low cost of 323 per meter cubed and the high price cost of 895 Rwandan francs per meter cubed, and the delay of WASAC in supplying water to its 13,000 customers in almost 210 days, which is caused by poor supply of water meters.
The Auditor General notes that the implementation of sanitation and hygiene projects worth over 110 billion Rwandan francs has been delayed and is now at the stage of tendering and relocating the residents where the project will be carried out. This may hinder the achievements of the objectives of speeding up the development.
Thank you very much, Gisle, for that report. According to the Ministry of Health, there are new methods being implemented to connect patient information with the help of technology in order to improve medical service delivery. Now, some residents in Kigali City also show that the use of technology assists them in accessing healthcare services in a timely and effective manner. Olive Nete has more on this report.
At Remera Health Center, a considerable number of people are seeking healthcare services. They are being received by those in charge using technology, unlike how it was done before. Some residents in Kigali City who seek healthcare services at different health institutions reiterate on the importance of technology in service provision.
Before, we used to go with papers from service to service, and at some point, if you take a child to the hospital, the child may take the paper and would have to go to the doctor again. Another thing is that sometimes the doctor's handwriting is hard to recognize and may confuse the laboratory technician, but when it is written in the computer, it is easily done and carried out.
This helped me in a number of ways. When I come to the hospital with my identification, I surely know that everything else will be processed very fast, and this is good, unlike before, where we used to wait for those papers. Not only those who receive services are satisfied with this technology, but also those who provide services in different levels of the hospital emphasize the importance of this technology in their work. It used to be hard because we had to write in files with our own handwriting, and that would take a very long time because we also had to make sure that they paid for the insurance. But since we started using technology in our activities, now we easily process everything. By the help of technology, we can easily track the payment process and help them faster so that they can be assisted in the consultation room. After that, his information is sent to the laboratory.
When a patient comes, we already have his full information in the system, and this computer serves all of these technologies we use here in the lab. When a doctor requests a certain exam, we immediately see it and do what we have to do, and after this same computer assists us in sending the results immediately to the doctor. Technology truly assisted us in a number of ways, but before we used to write so much. In order to further improve the services in the health sector, the Ministry of Health is implementing a program to store the patient's information in a system that can be accessed in all the hospitals in the country, and that by the help of technology, so that wherever the patient seeks health care, they can be able to access his information and provide further treatment. For example, now, everyone who goes to the same hospital that he attended before, the hospital has his basic history in the database, and sometimes we do not need to take his history again, and that reduces the time the patient spends with the doctor because they already have some of the patient's information needed. Currently, we are working to see how to create a system where information of the patient can be stored and can be accessed by all health facilities, be it public or private ones, using technology, so that when a patient goes to a different health facility from the previous one, they can be able to access his previous medical history. We started the implementation in some of the hospitals, but of course, the transfer of such information should go hand in hand with the policy to ensure confidentiality of the patient's information.
The Ministry of Health also notes that they are currently working on providing technology infrastructures to health centers and health posts that do not have access to it yet, since almost 85% of the medical care is provided from these centers until they reach the hospital level. Olive Nete, RTV News.
Thank you, Olive Nete, for that report. The Ministry of Local Government, Minalok, appreciates the role of Rwanda's civil society platform in associating with the government through implementation of various policies and programs. Adam Kwizera with more.
In an exhibition of services provided by various civil society organizations, some residents of the city of Kigali were explaining some of the services offered by those organizations, including those related to the prevention of natural disasters. They explained to us on how we can prevent those disasters, where they taught us some key points to prevent it, including those to switch off all electronic gadgets. The chairman of Rwanda Civil Society Platform, Dr. Joseph Murunziza Yarasa, points out the role of civil society in community well-being programs.
To make sure that citizens get to understand more the roles and responsibilities of the civil society organizations, but also because civil society work in different areas and in different sectors, different districts. So today it's an opportunity for even us, the civil society, to come together and try to assess the impact of what we are doing, and also to see how we can be able to advocate for some issues that we've came across during the implementation of the different programs being organized by different civil society organizations.
Kuwana Richard, the Director General in charge of Community Mobilization and Youth Volunteers Coordination in Community Policing in Minalok, demonstrates the contribution of civil society. When they meet together with JAF at the district level or sector level, they demonstrate the key priorities. Whenever the budget is limited, that's why the civil society comes up to assist us on those key priorities. Currently, there are more than 2,000 civil society organizations working in Rwanda, which collaborates with the Rwandan government in various activities, including improving their community's well-being. Adam Kwizera, RTV News.
Thank you, Adam, for that report. Residents of the Gicumbi district commend the government's provision of easy access to clean water, citing it as a relief from the long-distance trips in search of any water, regardless of the sanitation. Precious Kirezi with more.
Residents of Gicumbi district find it challenging to travel long distances to fetch water that sometimes turns out to be unclean. We fetch water from a marshland and it takes 40 minutes to get there and 40 back. When it rains, it's hard to walk and the water is dirty. I hope we're given access to water in close proximity. World Vision International has collaborated with the Water and Sanitation Corporation to provide easy access to water, which they were able to do with the water distribution points of Kajere sector that has impacted the community positively because they no longer have to travel long distances to fetch water. It was so much harder before, but now I can tell someone to help me get water without inconveniencing them. I am grateful to those that gave us access to water because now we won't go hungry or spend the day without a shower. The avail of clean water in the region currently has an 85% progress rate and intends to reach full capacity by 2024. The acting chief executive officer at WASAC emphasized that getting their goals to fruition would be more achievable if more people had a positive attitude towards infrastructure. The first step to achieving our goals is to build, but the next is to be intentional about conserving the infrastructure, which is why residents and local authorities should work together for things to stay intact. World Vision President Edgar Sandoval commends Rwanda's initiative to provide clean water to residents and will divulge World Vision's resources to partner with the country in that regard.
Fulfilling our commitment to bring clean water to more than 1 million people in Rwanda. I wanted to be here in person to see this incredible progress and the impact that is having on the life of your beautiful children, so that I can go back to America and share it with the American people and with our donors. They are going to be inspired by your commitment. Rwanda is demonstrating what progress and change is to the Rwandan government and local leaders. Thank you. We deeply appreciate the collaboration and support.
95,000 households in Gicumbi district, thereby accounting for 3 sectors, were privy to water provision, and World Vision has been responsible for distributing water to 15 districts across the country. Precious Tigezi, RTV News.
Thank you, Precious, for that report. Now, the Higher Education Council, an exhibition and STEM competition aimed at promoting involvement of higher learning institutions in research and innovation. Prince Manzi has more on this report.
Some of the students who participated in the exhibition demonstrate the impact of their projects on the society, especially in environmental conservation. We study carpentry. In economic zones, especially when carpentry is done, you find these things. We burn them, and the smoke produced is used to produce gas, and the rest is used to make briquettes. In simple, it is 3 in 1. Capital is one of the challenges to the implementation of these students' projects. Meanwhile, Akazi Kanoze Access Project committed to working on solving some of their challenges. The priority is training the youth after completing their studies, as they really need a lot. We have great partnership with the youth, universities, the public and the private sectors, with the aim of supporting and training the youth. The Director General of the Higher Education Council, Dr. Rose Mukangomeje, reiterates that the higher education play a big role in citizens' development, but also points out areas to strengthen.
A
student learn, but also get time to practice. We urge higher learning institutions to have partnerships with the private sector. Education is the basis of development.
In this competition, 32 projects were selected in 10 learning institutions. 5 projects will be awarded, with the winner to be awarded 5 million Rwandan francs. Prince Manzi, RwandaTV News.
On that note, we come to the end of our bulletin tonight, but on behalf of the production team and we would like to thank you for sticking with us on RTV News. We would like to tell you to have a great night and stay safe.